was a poor child. That's why I became so interested in the Head Start program. I actually had my own Head Start program. My parents were immigrants. English was not my first language. But back in those days, and to this day, there's a phenomenon in this country that we call settlement houses, like the Henry Settlement House in New York City. I went to preschool at the settlement house that I went to. I got my health services there. In many ways, it was like Head Start.
Head Start is about a child's educational needs, health needs, mental health needs, social needs in the house, making sure that the electricity is turned on. It's about parent involvement. It's about a whole host of things having to do with making sure that all the services that are necessary for that child to succeed are available for that child and that child's family. There's no child that exists all alone. Children exist within the context of their families and within the context of their communities. And Head Start takes that whole child approach to understanding the child, all the facets of the child, but also all the facets of the child within that family.
My favorite memory of Ed is when I was a graduate student, I was working on Schools of the 21st Century, which is a program that Ed developed to bring wraparound services and family support services into the public schools as a hub of support for families of young children. I was working with a school district in Ayer, Massachusetts, and I took a field trip with him, a road trip with Ed up to Ayer, Massachusetts, and went into one of the childcare classrooms with him and got to watch him read stories to 3- and 4-year-olds. And what was wonderful about this was to see him light up around kids and to see the rapport that he established right away with kids and how well he worked directly with them.
Well, anybody that knows child clinical psychology knows that if you're going to work with a child and try to improve its mental health, you had to prove with the parent as well. Head Start doesn't raise children. Parents raise children. So parent involvement was a brand new idea.
Well, a couple of years ago, we found out that my mentor, my dear mentor, Dr. Edward Zigler, had fallen. And he had fallen outside of his home and was taken to the hospital. They determined after a while that he was going to need surgery. He had broken the part of his leg that joins into the hip socket. And so when all of this happened, one of the anesthesiologists looked over at me and said, "Excuse me, is he talking about Head Start, the preschool program for poor children?" And he said, "You mean he ran Head Start for New Haven?" And I said, No. He was on the original planning committee for all of Head Start back in 1965 when Head Start began. He was right there and ran Head Start during the Nixon administration and has devoted his whole life to studying how to make Head Start a better program for the 35 million plus children that it served over the years. And Dr. Kim, the anesthesiologist, his jaw dropped and he went over to Dr. Zigler and he said, I was a Head Start graduate. My mother said that the only reason that I turned out as well off as I did in terms of my education was because I had such a good start to education from the preschool program that I went to, from the Head Start experience that I had. And he thanked Dr. Zigler. He thanked him many times. And after the surgery was over, he stayed in contact with me. And he wrote me emails asking how Dr. Zigler was doing. It was interesting. It really wasn't the kind of follow-up that sounded like a doctor checking in on a patient. It was more like a man checking in on his previously unknown benefactor, somebody that he felt had really helped change his life, but someone he had never met before.
The thing you have to remember is that before Head Start, there were programs for poor children in this country, but what characterized those programs was they were interested only in education. What Head Start did was it introduced really the whole child approach.
I think one of the things that's really important to recognize about the contribution that Ed has made to children and families in America is his pioneering work in bringing developmental science into the public policy sector. One example of that that relates to this topic of early care is the pioneering work that he and his students did in the 1970s when at what was then the Bush Center in Child Development and is now the Yale Zigler Center in Child Development and Social Policy. He and his students did the groundbreaking research that informed the development of the Family and Medical Leave Act.
What federal program has ever lasted 50 years? I can't think of any but Social Security. So it's had a life of its own. 1 million kids a year go through Head Start, and their parents go through Head Start. It's a lot of children. And it's going to be there. It's going to be there for 50 more years.